Hello, everyone. Good morning. My name is Ziad. I'm a pharmacist at Shoppers Drug Mart in Saddletown, northeast of Calgary. Beside me, I have my colleague Salman. We're going to start with very quick bios of ourselves, introductions. So sort of you get to know us, and then we'll move on to the main body of the presentation. So as I said, my name is Ziad. I'm from Sudan, originally in East Africa. Then I moved to the UK where I did my degree in Masters in Pharmacy. I worked in the UK for about 7 years after studying there. I worked in various sectors. I worked in community pharmacy mainly, but I also had a stint in hospital pharmacy, educational as well. And I did a couple of certifications there. Then I had my own business, recruiting pharmacists. Then I decided to move and immigrate to Canada. I came to Canada 2011, and I've been working for Shoppers Drug Mart since then. I worked in Ontario, came over to Alberta. I have various certifications, injection certified, a CDE, which is Certified Diabetes Educator. I have certification in opioid therapy as well from University of Calgary, as well as being a prescriber, additional prescribing authority. I enjoy barbecuing, I enjoy cycling, and I'm a huge Manchester United fan as well. So to all the Reds there, go Oli. So I'm gonna pass you over to Salman and introduce himself.
Hi there, this is Salman, just like my colleague said. My name is Salman. I'm a pharmacist here in Shoppers. I'm basically from Pakistan, born and brought up in Saudi Arabia. My education is BSc in Science and then PharmD in Pharmacy. I immigrated to Canada in 2018 and working for the Shoppers since then. Um, I'm an injected certified and soon I will be prescribing pharmacist as well. So I will pass to my colleague Ziad for the main presentation.
So while Salman is doing that, I just wanted to briefly talk about the structure of the presentation. The first part of the presentation will be about COVID-19, about the actual disease, how it spreads, how we can stop it, and why certain measures are important. Then we'll move over to the main body of the presentation, which is the vaccination, because we want to focus on vaccinations. So firstly, I would like to thank Irina and everyone who worked on this presentation. It's been a huge, tremendous effort, and it's coming in at a very good time now because we're seeing a dip in vaccination. So we need to bring that up, and we need to be doing everything that we could to bring up vaccination rates to combat such a serious disease as COVID-19. What is COVID-19? COVID-19 is a disease caused by a novel strain of coronavirus. So coronavirus is a big family of viruses that causes so many different disorders, such as SARS, such as common cold, MERS, Middle Eastern disease. It causes quite a few different disorders, but COVID-19 is a new novel strain of coronavirus. So I want to emphasize the word novel because that impacts a lot of the stuff that we're going to talk about. So novel means it's new, it's never been in circulation before. What that means and what that impacts is our knowledge of it, how we control it, how we can reduce the spread of COVID-19. So anything, because it's new, so we're still learning about it, and the scientific methods dictate that actually it's accumulation of knowledge, accumulation of data that will help us to deal with certain disorders and develop vaccines and develop measures to combat it. So it's whatever I tell you now, I mean, in probably a couple of months or a couple of years' time might become null and void, but the bulk of it should stand the test of time. So because it's new, we're still learning about it. CO stands for corona, V for virus, and D for disease. So that's what gives you the name COVID-19 is just the year that it was discovered. What are the symptoms of COVID-19? Because it's coronavirus, it's fairly similar to flu. It's fairly similar to the common cold. So you can get a little bit feverish, you can get shortness of breath, and that's what we're worried about, obviously. In more severe cases, it can lead to pneumonia or breathing difficulties. And that's what, amongst others, land people in hospital. So that's quite concerning if it gets to pneumonia, which is fluid in the lungs, problem breathing, and that could lead to hospitalization and death as well. So that's why testing is important, and that's why testing is required to confirm COVID-19. Because someone comes in with a cough and cold, I don't know whether it's COVID-19, whether it's a common cold or or the flu. So there's two types of testing: PCR and antigen. PCR is the gold standard. PCR looks for the genetic material of the actual virus. So it's pretty indicative of presence of a virus, presence of an active infection. Antigen looks for the protein that's on the surface of the virus. So it looks for bits of the virus, doesn't look inside the virus. So what that tells us, it gives us an indication. It helps us to screen out, but it doesn't confirm active infection. So anyone who tests positive for antigen testing, which is available in most pharmacies now, for a fee or for no fee, depending on the company you work for, we have to actually confirm by PCR. So we refer them to Alberta Health for a PCR test. How does COVID-19 spread? As with any coronavirus, is through being in the same vicinity as someone who's infected. So through coughing, sneezing, talking, singing, exercising with someone in a confined space that actually has the virus. And the issue with COVID-19, the biggest issue with COVID-19, and that's why it's unique, it can spread without showing symptoms. So I could be in the same room as someone who is not showing any symptoms. They're absolutely fine, and I could catch COVID-19 from them. That's why masking, social distancing are very effective measures in preventing the spread of the virus. So even if wearing a mask or having a social distance from someone doesn't impact you, can impact how you can transmit the virus to someone who's vulnerable. Then comes the issue of contact, spread of the virus, which is basically touching surfaces contaminated with the virus and then touching your face, like eyes, nose, or mouth. The virus may survive on some surfaces for quite a while. So that's why we need to make sure that we disinfect as much as possible. Moving on, who's at risk? So basically everyone is at risk, but there's certain populations or certain categories of patients that we worry about, and we need to make sure they are protected or are vaccinated at least. Older people, so they seem the older you are, the more at risk up to a certain point. But that's dropping actually. With the new variants now, we see in younger and younger patients ending up in hospital. People with chronic medical conditions, anything that can impact your immune system, or if you take in immunosuppressants, then we definitely, you're at risk. In terms of children, anyone who's under the age of 12, we've seen some infections. They definitely can spread the infection, not to the same extent as adults. However, they don't seem to be impacted as much by the disease. So they seem not immune to it, but they seem to be able to combat it and deal with it better. However, we've seen some hospitalization and death amongst kids as well. So we have to be extremely careful with kids as well. And now new variants seems to infect, younger people, seems to be more infectious, and consequently, they're actually deadlier because they just infect more people. So why do we have variants? This is one of the questions that people ask me, is like, how come variants came up so quickly? They didn't actually. The virus is spread all over the world, infect millions of people, and every virus replicates billions, trillions, quadrillions times within your body. It's an unimaginable number of cell divisions or replications within your own body within an episode of infection. So, and every time the virus replicates or divides, you can get a mutation. These mutations, 99.9% of them are harmless. If anything, sometimes they make the virus weaker. And this version of the virus will become instinct will actually go will go out of circulation because it's weaker. It doesn't infect more people. It cannot survive. So, but occasionally, what you get, you're gonna get a mutation that will make the virus stronger, will make it more infectious. And this is why we're getting these new variants now, as in Kent variant, as in Delta variant, as in Lambda variant now in Brazil as well. So it seems that they seem that it happens quickly within a month or so, but if you consider how many replications happen within a month in the virus, you start to understand why it happens very quickly in our lifetime, compared to human life. What is a vaccine? So just ignoring the screen now, I just want to talk about the vaccine and why the vaccine and how the vaccine works. So the simple idea is our immune system reacts to new foreign objects the same way as a kid, for example. Anyone who has a kid will know kids would like to feel stuff if they have a new toy, if they have a new objects in front of them. They wanna look at it, they wanna feel it, they wanna touch it, they wanna smell it, taste it, whatever, right? So it's the same way. And then they figure out, the kids will figure out, is this a threat? Is this something that I could eat? Does it have nutrition to it? Or something that I could play with? Or it has no value, I throw it out. So it's the same way our immune system react to new foreign objects. We want to grab it, they want to feel it, and the immune system then will produce antibodies if it perceives it as a threat. Antibodies is the key point here. We want antibodies. Antibodies are good. So we want to develop antibodies within the human body to make sure that we combat the virus, because that's what prepares us for the virus. So how can we introduce the virus or bits of the virus to the body in a safe, harmless way? And this is what vaccines achieve. It's just basically they take virus or bits of the virus and put it inside your body so your immune system can play with it and produce antibodies to it. So in the future, if you get exposed to the actual virus, you know what to do. Your immune system can nullify it, can kill it, and can make sure that you don't get infected. So that's what a vaccine is. It's a substance used to stimulate the production of antibodies, fighting entities within our bodies against foreign things and provide immunity. So there's two big types of COVID-19 vaccines. One of them is the big one, is mRNA. It's a new type of vaccine. And what mRNA does in essence, it basically teach our cells how to make a protein. So when we inject you with mRNA, we're injecting you with specific material, genetic material that actually will go into your cells. It doesn't go into the nucleus, so it doesn't affect your DNA at all. It goes to outside the nucleus within the body of the cell, and then it goes into certain structures within the cell, and that produces a spike protein. It doesn't produce the virus, it just produces the spike protein specific to the virus, and then that comes out of the cell into the bloodstream, into the main body, within your body, basically, and the immune system feels it and can produce antibodies to it. So it has a very high rate of success. It's a good vaccine. Then the other type is viral vector. So viral vector is just basically takes this the actual protein, the spike protein of the virus, puts it inside an empty shell, okay, which is another virus that doesn't cause any problems within to the human body, puts the spike protein inside the virus, the harmless virus, and then takes it and puts it inside, and then we inject you with that basically. So what's the big difference between the two types of vaccines? It's the biggest difference is actually manufacturing and storage, is not how it teaches your body. It's the same process. But you need to think about it this way. mRNA vaccine is easy to manufacture, hard to store and to transport. That's why you have to have it in -80 degrees and special freezers, and it lasts only like a month in the fridge. or even like a few hours outside the fridge. Viral vector or viral vector-based vaccines are hard to manufacture, but they're easier to transport and to store in our normal fridges or pharmacy-based fridges. So that's the biggest difference between them. How they teach you immune system to react is the same. It's exactly the same process. So now, one of them very common and important questions, is it good to mix and match the COVID vaccines? Health Canada continue to advise the mixing of mRNA vaccines, Pfizer and Moderna, as well as mixing AstraZeneca and mRNA vaccine is safe and effective. I would add just one thing to that. Get the first vaccine that you can get your hands on. It's if given the choice, stick to the same vaccine that you had as your first dose, because that's licensed by the manufacturer. It's gone through rigorous testing. We know it's the safest option and the best option. But if you had Pfizer and then it's only Moderna is available, take the Moderna, because it's same, effectively is interchangeable. AstraZeneca is drying up. We don't have supply of AstraZeneca. We only have mRNA now. So second dose of mRNA, actually, there's some studies coming out, actually proves that it gives you better, it gives you a better immune response, yeah? So what's one of the main questions as well, wait times between first and second dose. For Pfizer and Moderna is 1 to 4 months. If the first dose is AstraZeneca, then 8 weeks between second doses. One of the best questions that I get asked is like, you guys, you said it was 4 months. Now you're saying it's 1 month. Make up your mind. Totally fair point. It's to do with the supply of the vaccine. It's nothing to do with the effectiveness of the vaccine, license of the vaccine, or anything like that. It's licensed to be given 1 month apart, yeah? The first and second dose for most vaccines, except for AstraZeneca. But the issue is, we didn't know, like, cast your mind back 4 or 5 months, we didn't know how many vaccines we're gonna get, what's the supply like. That's why we said, oh, you know what, let's spread it out as thinly as possible, and let's vaccinate as many people with the first dose as possible. That's why there was the 4 months waiting period. But once the supply has been established and we know there's more supplies coming in, you know, we reduced it to the recommended 1 month. Moving on, can there be long-term consequences when getting the vaccine? No, absolutely, probably 100, like very unlikely. Is not expected to have any long-term negative effects, because from the data we see the most negative effects is only like a couple of days to a few weeks, so 6 weeks from receiving the vaccine, which is why the FDA asked the companies to provide 8 weeks of safety data. So rather than 6 weeks, they went a little bit further and they said, give me 8 weeks of safety data. Secondly, the actual structure of the mRNA molecule does not last long in the body at all. It lasts for a few days, and then after that, it breaks down. So you won't have any negative effects from the vaccine. Possible side effects of the and reactions of the vaccine. It's mainly the injection site reaction. So you can see a bit of redness, soreness, and swelling. And then you get the systemic side effects. So chills, fatigue, joint pain, headaches, mild fever, muscle aches, that sort of thing can happen. But it's just one thing I wanted to highlight. You cannot get COVID, the disease itself, from the vaccine. It's not going to happen, because we're not injecting you with the virus itself, or even weaker versions of it. So why did I highlight it? In most cases, you know, the bits in red here, in most cases, side effects of the vaccine is actually a good thing, because that's basically your body reacting to the vaccine. We know the immune system is reacting to it now, it's feeling it, it's tasting it, it's smelling it, and now it's producing antibodies. So, you know, it's very unpleasant to have side effects to any vaccine, but it's something that's actually we welcome. Someone phones us and say, I had certain side effects to the vaccine. Good, that's actually not a bad thing. I know it's unpleasant. Take some Tylenol, take some Advil, relieve yourself from these sort of side effects. Be as comfortable as you can, but they normally don't last a long time, so only like 1 or 2 days, and then you're back to normal. COVID-19 vaccines and children. So at the moment, it's only the Pfizer-BioNTech vaccine is licensed from 12 years old. Moderna and AstraZeneca are licensed from 18. So it's there's only one of them that's licensed now, but mRNA vaccines are being tested in younger kids, and we are waiting the results. So soon we should know whether it's safe and effective for the population. So a very important question: how long does the protection from COVID-19 vaccines last? And it's a question that I get asked all the time. It's like, would I need another dose in 12 months' time? We don't know exactly. We're not really sure. Again, accumulation of data will allow us to answer these questions better in a few months' time. But from what we know from the flu vaccine, from other vaccines, vaccines effect tends to wear off after time. And there might be other variants as well, other strains, so we need to protect people against. So as we know that minimum now is 6 months, you very, very unlikely to catch a bad case of COVID-19. But it's likely to be longer, might be 12 months or so. It remains to be seen, but booster shots are likely. I'm going to pass it over now to Salman. He will address some of the questions that we highlighted, highlighting the more important ones in red. So
first question, after you take the COVID-19 vaccine, can we go outside without mask? Well, it's hard to answer. It depends. Yes, you have developed the immunity against the COVID-19 major virus variant, but it all depends on the location where you live and what are the city bylaws. For example, in Alberta, yes, you can go in outside without mask, but if you are using the public transport, for example, or certain hospitals, you need to have mask. Even if you are going for the vaccination, for example, for the second shot or the first shot, you need to have a mask with you. The other question, if we remove the mask, we are no longer vulnerable to infections? No. So there are different strains of the virus. You can still catch the other variant infection or the same variant infection, but the severity will be less. So you still need a protection. Another question, how do we know that COVID-19 vaccines are safe? Well, there are millions of doses given all around the world, and there is very less number of people who got a serious side effects from this. So I think that COVID-19 is one of the vaccines in the history which is given in such a large number with such a small reactions or side effects. So talking from the data, yes, it's safe. Question 4, I was breastfeeding. If someone is breastfeeding or expecting mothers, yes, the vaccine is completely safe and it's highly recommended to get it because small babies, they cannot get the vaccine and you do not want to pass the COVID-19 infection from you to the small baby or kids. So it's highly recommended for the breastfeedings and expecting mothers to get the COVID vaccine. Which COVID-19 vaccine is the best? Well, the first vaccine you can get in your arm is the best one. Right now in Canada, only the mRNA vaccines, which is the Pfizer and Moderna, is available. Both are good vaccines. There is no difference. Whatever is available, you can get one. If I have a medical condition, can I be vaccinated? Yes. So it's actually people with medical conditions are more prone or at a higher risk of getting the infections. So actually it's recommended if you have a certain medical condition, you should get your vaccine first. Another question, is it mandatory to get a COVID-19 vaccine? No, it's a personal choice. Right now, we are not a politician, so we are not sure about any law which will be coming in the future or no. But right now, it's not mandatory. but it's highly recommended because you play a role for your safety and your community as well. Uh, do I need the second dose of vaccine if I got the first one? Yes. So for the complete vaccination, you need two doses. It can be 1 month apart till 4 months, as my colleague Ziad has told you earlier. Do I need the second? Sorry, after I got the second dose of COVID-19 vaccine, I had a fever and felt dizzy. Is it okay? Yeah, this is a common side effects. Some people get some few side effects after the first dose. The other people get after the second dose. It's quite common. It means your body is reacting to the vaccine. It's producing the antibodies. It's actually a good thing. It will last 1 to 2 days, maybe 3 days. Just take the regular Tylenol or whatever the other over-the-counter painkillers. Just consult with the nearest pharmacist, and they will help you out. Has everyone received COVID-19 vaccine? No, not yet. In Canada, at least, no. In worldwide, no. Uh, we are still rolling out the vaccine, and hopefully, maybe within a couple of next months, we'll be better in shape. If I use hand sanitizer, I will not get COVID-19. Is it true? Not necessarily. So basically, like my colleague Ziad has earlier explained, that the COVID-19 can spread through droplets in the air. So even if you use a hand sanitizer, the masking, the social distancing, the getting yourself the vaccine, and the other protective measures is very necessary. Only hand sanitizer is not enough. Another question, if we get two doses of vaccine, can we still get COVID-19? Well, yes. So the point of COVID-19 vaccine is not to stop you from getting the COVID-19 disease itself, but it's not let you land into the hospital or emergency, or stopping yourself, getting yourself killed from the COVID-19. So suppose if there is a two people, Mr. X and Y, and X is fully vaccinated and Y is not vaccinated, both get the same strain of COVID-19 infection. So it is likely the person who got the vaccine will not end up in the hospital or die. The other person will, there's a high chances that he can land up in the emergency, or he can even die. So getting yourself vaccinated, you will save yourself from getting into the emergency or end up dying. So important question, how do you book for the COVID vaccine in Alberta? Basically, there is two ways. Through AHS, Alberta Health Services, you can go online to the Alberta Health Services website and book yourself. You have to have your personal health card numbers and other date of birth, name, and other personal data just to book it, or call 811. The online is recommended because calling 811 is a health link, so you probably have to wait for several minutes. The other thing is there is a lot of participating pharmacies like Shoppers. You can just call the nearest Shoppers or any other pharmacy nearby and just double check with them if they are vaccinating. And yes, for example, most of the Shoppers right now, including ourselves, are doing the walk-ins as well. If you want your first dose, just call us and you might be able to get your first dose on the same day. What to expect at the vaccination day? It depends on the location. So number one thing, just contact with them, read your email if you received any email for confirmation or a text message. You need to bring your identification. If you have an Alberta health card, just bring it with you. Just wear a loose shirt. If it can be sleeveless, it would be better. It's make our life easier. And that's it. The injection is basically in the arm, like the other jabs. Um, and then after the vaccination, you have to wait at least 15 minutes at the location, just in case if you get any allergic reaction or something. You will also receive a paperwork or a certificate for getting your first dose or second dose, whatever the case may be.